This is Jeremy with Chiral Clarity, and in this video, we're going to be going over the diaphragmatic hiati. Now, there are three diaphragmatic hiati that we will be discussing in this video. One for the inferior vena cava, the esophagus, and the descending thoracic aorta, named in anterior to posterior orientation, meaning the inferior vena cava diaphragmatic hiatus is the most anterior of the three, whereas the descending thoracic aorta diaphragmatic hiatus is the most posterior of the three. Therefore, the esophageal diaphragmatic hiatus is in the middle. It's between those two. Now, the way in which we remember these three diaphragmatic hiati is the mnemonic, I ate 10 eggs at noon. Now, I stands for inferior vena cava, and 8 stands for the number 8, telling us that the inferior vena cava pierces the diaphragm at vertebral level T8. 10 stands for vertebral level T10, and eggs, the E in eggs, stands for esophagus, telling us that the esophagus pierces the diaphragm at vertebral level T10. To the same degree, at stands for aorta, implying descending thoracic aorta, and noon stands for the number 12, telling us that the descending thoracic aorta pierces the diaphragm at vertebral level T12. Now, aside from these three main structures going through these diaphragmatic hiati, there are other structures that go through some of these diaphragmatic hiati as well, specifically the esophageal and aortic diaphragmatic hiati. Looking at the esophagus hiatus, other than the esophagus going through this hiatus at vertebral level T10, we also have the anterior and posterior vagal trunks. Now, before they are the anterior and posterior vagal trunks, they are the left and right vagal nerves, respectively. This is because during embryological development, the foregut rotates 90 degrees clockwise, and these nerves go with it. Left vagal nerve, right vagal nerve, 90 degrees of clockwise rotation, anterior vagal trunk, posterior vagal trunk. Therefore, at the esophageal hiatus, or esophageal diaphragmatic hiatus at vertebral level T10, not only do we have the esophagus, but we have the anterior and posterior vagal trunks. Furthermore, at the descending thoracic aorta, not esophageal, but the descending thoracic aorta diaphragmatic hiatus at vertebral level T12, we have the thoracic duct and the zygous vein. The thoracic duct starts at vertebral level L2 as cisterna chyli, and that starts on the right side of the body below the diaphragm. Now, we have to remember that the diaphragm is skeletal muscle innervated by the phrenic nerve, which has the complete spinal distribution C3, C4, C5. And that skeletal muscle of the diaphragm that's innervated by the phrenic nerve is the structure being pierced by these three different structures, creating these three different hiati.